Hi, this is Jordan, and today we're going to talk about the Oasis item M2020. I know this is super exciting, but it is a question that we as a branch are struggling with pretty much across the board. And so rather than making you guys take the time to sit and read your Oasis books, because I know that can be boring and it is really hard to glean some important information out of it, I figured I would go through the book and summarize some of the most outstanding parts and some things I feel we might be missing. As we go through the recording, there will be a passphrase. So it's 3 words that I'm going to clearly call out that make one passphrase that you will use to let me know that you listen to the recording. So the first secret passphrase is medications. And I will ask that you not share the passphrase with others. There will also be some questions to make sure that not only did you listen to the recording, but that you fully comprehended the information inside the recording. So let's just get started with the question. The question once again is M2020, Management of Oral Medications. And it reads on the Oasis as such. Patients' current ability to prepare and take all oral medications reliably and safely, including administration of the correct dosage at the appropriate times and intervals. This excludes injectable NIV medication. And note, this refers to ability, not compliance or willingness. And that's super important that we are judging their ability. So the answers go as follows. With 0 being the most independent and 3 being the least independent. The first option is 0. It's able to independently take the correct oral medications and proper dosage at the correct time. The answer number 1 is able to take medications at the correct times if individual doses are prepared in advance by another person, or if another person develops a drug diary or a chart. Number 2 is able to take medications at the correct time if given reminders by another person at the appropriate time. And 3 is that they're unable to take medications unless administered by another person. So let's kind of talk about why this question is so important, why we stress it so hard. This affects our outcome measures. So that means that this is how a lot of facilities will judge us on whether or not we're a quality home health provider, including the state. It's also a star rating, and so it heavily plays into how our agency is rated on the star ratio. It also is a risk factor adjustment, and if you don't recall from previous conversations, risk factor adjustments, there's a lot of questions in the Oasis that count as risk factors, but this will affect how they judge other questions as well. So if we do poorly on rating M2020, that will mean that our other questions may be marked as declines, even if we had some mild improvement, because this question did not reflect the patient's ability well enough. So it is so crucial that we answer this question appropriately at start of care and at discharge. So let's talk about the intent of M2020. As the Oasis book puts it, this item is intended to identify the patient's ability to take all oral or PO medications reliably and safely on the day of assessment. And this is super important, on the day of assessment. So if we are taking into account PRN oral medications, they would have had to have needed that PRN oral medication in the last 24 hours. So let's say Miss Smith, she's 95. She can't remember to take her PRN hydrocodone when she's in pain, but she can remember to take all of her other medications. We're going to rate her based, as always, on the worst medication, the one that she has the most trouble with. So that would be the hydrocodone, and she would need assistance with that based on that. So we wouldn't rate her as 1, able to take it when individually prepared if she uses a med chart or a diary, like we would normally if she didn't need the hydrocodone. We're going to take her up a couple notches just because of that hydrocodone needing assistance. So just a reminder, this is to identify a patient's ability Willingness and adherence aren't the focus of this item, and that's so important to remember. When we talk about ability, we're not just talking about their ability to get up and walk and get the medications. We're also talking about their mental and emotional status. So, dementia, of course, can play a role. Their physical ability, we all know, can play a huge role in their ability to get their medications, but also something like anxiety. Mr. Smith is afraid to take his medications correctly due to lack of knowledge. We may teach him and assuade those fears on that first visit, but we are basing on the last 24 hours, and he hasn't been able to take them correctly because he's afraid that his increased Lasix is going to cause kidney failure. So that can be taken into account per CMS guidelines. Let's see. We can also talk about sensory impairments. So a person who has sensory impairments, blindness, or trouble feeling to get their pill bottles open, that can definitely be taken into account when we're answering M2020, and it is so important that we take those in. The last factor that we're going to take into account when answering M2020 is their environmental status. So there may be things in the way of them getting their medications without assistance, such as stairs. Maybe their daughter keeps them on top of the fridge. This is especially true when it comes to PRN or not standard medications that they may need to ask for help to get. So don't forget that environmental factors can play a role. This can be as simple as they can't get their walker through their door without help. So don't forget to take that into account. Just for reference, the time points in which this item is completed is start of care, resumption of care, and discharge from agency not to an inpatient facility. Next, I would like to reference some specific instructions CMS gives us in regards to this question. It's going to include all prescribed and over-the-counter PO medications. It's going to exclude topical, injectable, and IV medications, but it will also exclude any sublingual medications. And for some people, I know that can be a surprise. If the patient sets up his or her own planner device, that's going to be regarded as them administering their own medications. So the assessment also includes the patient's ability to obtain the medication from where it's routinely stored and their ability to read the label. CMS guides us to enter response 1 if the patient is independent in oral medication administration, if another person must prepare the individual doses in advance, and using those modifications, the patient can take all their appropriate medications. You're going to enter response 2 if daily reminders to take the medication are necessary, whether they have a planner or not. And this is regardless of whether the patient is independent or needs assistance, because they're still going to require those reminders. If medication is ordered PRN and the medication is needed by the patient on the day of assessment and the patient needs a reminder to take the PRN medications on the day of assessment, you're going to enter a response 2. And that's something that we discussed previously, but it is so important to ask about those PRN medications because that's something that may end up helping our outcomes. You're going to enter response 3 if the patient does not have physical or cognitive ability on the day of assessment to take all the medications correctly. So let's take into account our patients with mild dementia that may have sundowners or people that hurt more in the evening than they do during the day. So some people wax and wane, and we have to take into account their worst part of that last 24 hours. If the patient's ability to manage oral medications varies from medication to medication, once again, you're going to consider the medication for which the patient needs the most assistance. And for a patient residing in the assisted living facility where the facility holds and administers the medications, remember that you are going to report on their ability. We have several patients that regardless of the facility administering their medications, they have the ability to do it without the facility. They just choose to use that service. And that's something that we've discussed in previous meetings, that it's hard to approve somebody who lives in an assisted living who's administered their medications. Our due diligence is to still assess that ability, regardless of who's giving the meds. And please remember that, because being in an assisted living facility is not a good reason to just mark them as a 3 on admission and on discharge. It is time for the second word in our passphrase, and that's going to be save. The second word in the passphrase is save. So next, I want to talk about how CMS determines that we should collect this data. The first and foremost is going to be observation and demonstration, and it is preferred, but it is not going to really obtain the last 24 hours. It can't be our only data set. We can look at documentation from other agency staff. So if a therapist goes out later that day and they observe that the patient is doing a little bit worse, we can definitely take that into account. An important part is going to be the patient and caregiver interview. Ask them, how is she taking her medications in the evening? What kind of assistance are we having to give, and what difficulties is she having? Ask the patient, what do you take this medication for, and when do you take it? It's going to be a good determiner on whether or not they have the ability to take them independently. You're of course going to look at their physical assessment to see if they can get them, and you want to check their cognitive assessment to make sure that they are able to recall. Once again, you're going to look at their environmental assessment, and you can always look, if you have questions about a specific circumstance, you can also look at the Oasis questions and answers on the CMS Oasis webpage, or you can look in your Oasis book that you have for reference. The last thing I want to discuss is some of the CMS Q&As that they have at the end of the question. I would prefer that you read through these also independently, but I'm going to point out some high points that maybe you didn't realize. The first Oasis Q&A I'd like to discuss is the question, at start of care, a patient was only prescribed 2 PO medications, Tamiflu 30 milligrams daily for 7 days, and Ativan 0.5 milligrams, taking half a tab at bedtime as needed for anxiety. 3 weeks later, the patient is discharged, and at discharge, the Tamiflu is ended, of course, and the only medication the patient is prescribed is PRN Ativan. And per the rule that we used the last 24 hours, the Ativan was not necessary over the past 24 hours. So how should we code M2020? So at start of care, you're going to rate them per their ability. But at discharge, CMS is indicating that we should enter an NA, no oral medications prescribed. This is not fully accurate, but it is the closest accurate answer that we can give for Oasis data. So just kind of be aware of that in case that kind of specific situation pops up. I know we do have patients that are on few medications. Another interesting question that's answered in the Q&A books is, when scoring M2020, management of oral medication, should medication management tasks related to filling and reordering and obtaining the medications be considered? And CMS answers that no, that should not be considered. However, we do want to keep in mind that later in Oasis Answers books, it does indicate that if a patient is unable to does not have their medications because they are unable to afford them, we're going to answer them as a 3. So inability to afford medications is definitely going to be an issue with socioeconomic status, and we will consider that they need maximum assistance getting those meds so that they can take them. However, keep in mind that if it is based on a refusal, if a patient is refusing to go pick up their meds, that is not going to be taken into account. We will go back to the ability-based rating. Okay, so the next question we have is an interesting one, and probably one that you've run into several times. A patient is typically independent when they're managing their own medications. However, at the time of assessment, the patient's daughter and grandchildren have moved in to help take care of the patient, and the daughter decided to place the meds out of reach for the patient's safety. This now requires someone to assist the patient to retrieve the medications. And how should we answer the question? So this actually offers us as an agency a great room for improvement, because on the day of assessment with the patient's meds out of reach, it does require assistance of another person for them to obtain the medications out of storage. So we can rate that patient based on that. However, on discharge, if the family has gone back to wherever they generally live and the patient can reach their medications, we can show that she's had a significant improvement in her ability. The next situation I want to talk about is a patient with schizophrenia is not compliant with his medication regimen when he must pour all of his medications from the bottle. So the nurse discovers after admission that if a pharmacist prepares the medications in bubble pack, the patient is less paranoid and is able to open the pack and will safely and reliably take all the medications at the correct time. Since the patient is able to take and manage his medications once they're in the home, and the bubble pack is he considered independent or a response 0 in the medication management at discharge. And M2020 is, as we've discussed, assessing if the patient has the ability. So this patient could be assessed at discharge as having a 0 since they are able to independently get their medications out of the bubble pack, and that is what we would consider a great win for home health, allowing them to have more independence. Another question that we're going to discuss is more important as we have patients that are more technology driven or use HRS medication reminders. So the question is, what is the appropriate response to M2020 management of oral medications when the nurse sets up a medication dispenser that has a visual alarm and an automated verbal message reminding the patient to take the medication? This medication dispenser also calls a caregiver if the patient does not respond to the alarms. So if the patient requires another person to give them daily reminders and the patient takes all of their medications on the day of assessment, they are considered a 2. And that also accounts for automated dispensing systems or automated reminders that the patient cannot set up themselves. However, if the patient sets up the reminders themselves, they might be considered lower. It just depends on what kind of assistance they need from another person to remind them. Okay, so some of the other interesting questions include, are inhaled medications and sublingual medications considered? And the answer is simply no, we don't count those in M2020. And also, based on reading recent guidelines, this person asking the question is not sure if they should include swish and expectorant. So this would not count because they are spitting them out. This would only include, M2020 would only include medications that are intended to be absorbed within the gastrointestinal system. All right, so there's only 2 more questions that I want to talk about, but I do want to give you the last code of the last word of the passphrase is lives. Again, the third word in the passphrase is lives. So the question that I want to discuss is rather long but important. So the patient is on multiple medications which span a 3-day time period. Yesterday, the doctor started her on varying doses of prednisone, and the patient admits to being confused about the directions and the right doses. The clinician observes that the med box the patient set up is filled correctly with all the usual medications, but not correctly with the prednisone administration. So we would characterize this patient as a 3 because we're basing them on the medication that needs the most assistance. And this patient has not been able to take their prednisone correctly without assistance due to the varying doses. So regardless of how we feel they could do if we set up their medication box with their prednisone in varying doses, we can't guess how someone will do with the med box. We have to go off of what they have done for the past 24 hours. And I think that's important because we do see a lot of patients that we feel would do well with a med box and be independent, but we can't make that assumption. We can only observe what is already happening. So please keep that in mind when coding, especially on start of care with a patient who's borderline. We have to look at what's actually happening. It's much like we can't base someone that's having trouble ambulating off of our feelings of their ability with if they had a DME such as a walker. We can only base off of what's in the home. So the last question I want to discuss is if a patient can't swallow his or her medications but is able to do all the other requirements for oral medications at the time, how would you rate this question? So you find that a patient's just having trouble swallowing. This does not include for someone who's using a GI tube to administer medications. So if you go into a patient's home and you find that they're unable to swallow one of their pills, it may be too large, they don't know to cut the medication, they don't know to dissolve their potassium, then you're going to answer that question as a response 3, unable to take their medications unless administered by another person. And that is just because it is the best response. Of course, we want to find an intervention for this patient or see if the doctor can prescribe something that they're more easily able to swallow. But on that start of care, we're going to answer them as a 3. Okay, and that finalizes our conversation about M2020. I want to thank you for listening to this, and please let me know if this was helpful, and I hope that you can refer back to this in the future if you're having any trouble with the question. Thank you for your dedication to ensuring that we can improve our outcomes.